Well, for far too many veterans, there are serious challenges that they may face after leaving the military. This includes higher rates of substance abuse, PTSD, depression, and even difficulty transitioning back to civilian life. So joining us today on this Veterans Day to talk about how we loved ones can best support struggling veterans is Bill Reynolds with Meadows Behavioral Health Care. Bill, good morning to you. First of all, 30 years in the Navy. Thank you for your service,
you're
sir.
welcome.
Really appreciate that. Let's talk about why veterans face this unique challenge, addiction, PTSD, the struggle to reintegrate back into real life.
Yeah, I think it's multifactorial, but you have a lot of veterans that have deployed multiple times to the Middle East typically, and they're exposed to combat situations, and a lot of the veterans have deployed multiple times, so it's repetitive combat trauma that they experience. Yeah. So they get in the mode of increased adrenaline in their symptoms in their system. They also have hypervigilance, hyperarousal. Yeah. So when they transition back to civilian life, it's difficult to get used to that.
Well, the other thing I think that so many of us discount is experiencing what they experience in a combat setting is not normal.
Correct.
It's incredibly violent, incredibly disturbing, and they're programmed while they're there to be soldiers, but they come back and then all of a sudden that reality sets in, right?
Yeah, it does. And to complicate matters further, you also have a lot of guys that have suffered serious injuries, so they struggle with chronic pain, and then on top of that, the PTS, the post-traumatic stress. So turning to substances is kind of a natural, alternative for them. They self-medicate because nobody likes to be in pain, right?
Yeah, it's funny because I feel like it's not funny at all, actually, but I feel like we really started to see the advent of PTSD and it coming to light with our Vietnam vets when they came home. But I feel like we haven't properly addressed it. There's something called integrated trauma-informed treatment. What is that? So
at the Meadows, where I work at, so we have a veterans program there. What we do is we look at the whole person, right? I've talked to a lot of my veterans over the past many years, and many of them have been to treatment before, but it's typically just for addiction, and the trauma is not addressed. So you have to look at the whole person. So what we do is, we do a complete head-to-toe assessment. They get a physical exam, they get lab work, they get a psychiatric evaluation, because it's easy to focus on the addiction, but oftentimes the trauma is overlooked. So I call trauma the fire in the basement that is easy to overlook. So we look at the whole person.
And you address the fire in the basement?
Yes, we do. We get the fire in the basement with things like trauma, evidence-based therapies like EMDR, somatic experiencing, and the veterans really love the small groups. There's a lot of healing there.
In fact, it's funny, I wanted to ask you about that very specifically. I imagine there is incredible amount of healing when you come together with those who've shared that experience.
Yes, correct. Yeah, it's a tough crowd to get veterans to come into treatment to begin with. Yeah. So when they finally do take that big step, it's important. Like when they come to the Meadows, they have a built-in family. They have the brotherhood, and we talk a lot about tribe.
The mentality of those who are in the military, there's a certain pride and there's a certain strength, there's a certain courage that comes along with that. How do we as family members help to break down that wall and help our veterans, our family members, say it's okay to reach out for help?
I think the biggest thing families can do is just support the veteran. It's not their job to fix the person per se. They have to be ready for treatment. One of the things that we do at the Meadows when people do come into treatment is we have a family program. So the families are often the unsung heroes, kind of behind the scenes that support the veterans. So they need help as well. But basically, yeah, just to support the veteran, just listen, be non-judgmental.
Yeah, today I hope that our veterans feel appreciated, not just today, but every day. But on those days when they're hitting their lowest point, Bill, you are a veteran yourself. Can you speak to that veteran at home right now who's watching, who may be struggling? What do you want to say to them?
Ask for help. I know it's hard. It's like one of the hardest things people will ever do. I mean, to include veterans. And, we really just try. There is strength in surrender. The help is available. So it's not a weakness at all. As a matter of fact, it shows a great deal of strength to finally say, hey, I need some help. And I also want to let veterans out there know you're not alone. Brothers and sisters, there's a lot of people out there that are struggling. You are definitely not alone.
I feel like that should be the phrase of the day, strength in surrender.
Yes.
Bill Reynolds, Meadows Behavioral Health Care. Thank you so much for the important conversation today. Appreciate your time and appreciate your service, sir.
Thank you, Gina.